You brush your teeth every day, but do you ever wonder whether you're actually harming your teeth or not? Because if you choose the wrong toothbrush and toothpaste, you're slowly damaging your teeth every day. I'm sure that when you walk past the toothbrush aisle in a store or buy toothpaste online, you don't really pay much attention to the fine print on the box. Most likely you make your choice at random, based on advertising, the price, or just whichever one catches your eye the most. Give this a like if that's what you do. I understand you. I also often just want to pick any toothpaste, but knowing everything that will be covered in this video, I make my choice quickly and, most importantly, without harming my teeth. The main problems that can arise from making the wrong choice are damage to your tooth enamel. Increased sensitivity can develop, your gums may even start to recede or bleed, and that can eventually lead to tooth loss in a few years. The good news is that this process is not fast and you can stop it right away by learning how to choose the right toothbrush and toothpaste. So make sure to watch this video until the end. In fact, choosing a toothbrush and toothpaste is a very important decision, and it affects not only the condition of your enamel and gums, but can also impact your entire dental and jaw system as a whole. But in this video, I will tell you how to choose a regular toothpaste and a regular toothbrush without falling for marketing tricks or advertising gimmicks while still keeping your teeth healthy. So, how do you choose a toothbrush? The first thing you need to pay attention to is the handle of the toothbrush. How comfortable it feels in your hand is very important, as this greatly affects the quality of your brushing. In other words, we need to make sweeping motions to clean our teeth, and our toothbrush, more specifically its handle, should not slip out of our hand. That is, when you pick it up, you should be able to position it comfortably, and it should easily follow your movements without falling out or slipping in your palm. This is especially important because we often brush our teeth with wet hands. The second thing to consider when choosing a toothbrush is an important parameter, the stiffness of the toothbrush. There are 5 types of bristle stiffness. These are very soft, soft, medium, hard, and very hard. You need to take the choice of bristle stiffness very seriously. The condition of your enamel will depend on this. A toothbrush with very hard bristles can damage your enamel. In other words, you might wear it down, make it sensitive, or injure it. On the other hand, if the toothbrush is too soft, you won't clean plaque effectively, meaning it will build up. That's why you should be extremely careful when making your choice. Very often, of course, we choose the bristle stiffness intuitively, based on what feels comfortable to us, because as soon as the brush is a bit harder, we notice it right away. Or if it's a bit softer, it feels like it's not enough for cleaning. That's why, of course, most people tend to choose, let's say, a medium bristle brush. But there are clinical cases. If you have sensitive, injured, or inflamed gums, then of course you need to use a soft toothbrush and only a soft toothbrush. Or if you have any inflammatory processes in your mouth or, God forbid, injuries, then of course we temporarily use a soft toothbrush. Nevertheless, I still want to emphasize this point. In any case, it's best to leave the choice of toothbrush to your dentist. At least once, you should visit a dentist to check how strong your enamel is, how healthy it is, and how strong and healthy your gums are. And of course, together with your doctor, you will choose the right level of firmness for yourself.
But let's say a person doesn't have any issues related to choosing a toothbrush. For example, their gums don't bleed, everything is fine. Is it possible for someone to figure out on their own, without seeing a doctor, whether they've chosen the right toothbrush?
Absolutely, they can figure it out. The first thing we do after brushing, so after the patient has brushed their teeth, is of course we check with the tongue to feel how clean the teeth are. That is, the teeth should feel smooth with no plaque left anywhere. So you definitely need to check not only with your tongue but also visually. Also stand in front of a mirror, open your mouth and show your teeth to yourself. The first check is the quality of plaque removal. That's the first thing. Second, of course, if a patient brushes their teeth and starts experiencing increased sensitivity, for example, they start using a new toothbrush for a week, and after a week they develop sensitivity to cold and hot, like when they're outside, especially in cold weather, they inhale and suddenly feel sharp pain, which wasn't there before, but they changed their toothbrush and it's clearly too hard, so the patient chose the wrong one with the hardness. Of course, there's this situation. When choosing a toothbrush, the hardness is always indicated, yes, but sometimes the actual hardness doesn't match what's stated. For example, it says medium hardness, but it's actually hard, or it says soft, but it's actually medium. This happens, so it's possible to make a mistake here as well. That's why I said that ultimately you should rely not just on intuition, but on how it feels to you personally. So the first criterion is cleaning. How well did you actually clean? Check whether there is any plaque left and whether you experience any sensitivity or, God forbid, if your gums start bleeding after brushing or if they become inflamed after using a new toothbrush. These are actually the main criteria. So if we're not talking about, let's say you want to determine for yourself whether you made the right choice, but again, in my opinion, it's not entirely logical to expect a person to just feel it. Although probably there are patients who end up harming themselves.
But visually, is it possible to tell if I'm brushing my teeth poorly or well?
Visually well, of course you can tell. Plaque. Plaque builds up in those areas. This is especially noticeable on the distal back teeth when the patient can't reach them properly or doesn't clean them well. So plaque just starts to form, there's more and more of it, and then bad breath develops. And the worst thing is that tartar can eventually form on this plaque. So this plaque will turn into tartar. It's like, how can I compare this? Maybe it's like washing windows, right? So we wash a window, we look at it, and we see that in the center, everything is clean, but along the edges, something is left behind. It's actually the same with teeth. You really need to look closely and clean thoroughly. That's why we say brushing should be controlled. It should be controlled not only in terms of movements, meaning you need to use the correct motions. That's the first aspect of controlling toothbrushing. We check in the mirror to make sure our movements are correct using sweeping motions. And by control, we also mean that afterwards we check, look, and if something hasn't been cleaned properly, we go over it again, just right there in the same spot. Even if you've already rinsed off the toothpaste and rinsed your mouth, just take your brush again, even without toothpaste if needed, but go over that area once more with the brush. And for this, by the way, we also use floss, yes, when we clean the spaces between the teeth once more. Control visually. If, of course, the person has good eyesight, then it's very easy to see visually. And in addition, nowadays, not only dentists and doctors during appointments, but also regular patients have access to so-called plaque indicators. They are sold on all the marketplaces. You can easily use one, check, and see the areas that you haven't cleaned properly. And in addition to that, there are now plenty of electric toothbrushes that analyze the areas and segments you brush, and they send a report directly to your mobile phone showing you which areas you neglected or didn't clean well. So there you go, just pay more attention to that area. So there are actually a lot of tools available, but still, I want to be a specialist in this matter. And that's why I always ask patients to visit a dentist at least once a year, show them, explain things, and together, after all, a specialist has, let's say, more experience, and they really can tell you exactly what you need. You can save yourself a lot of headaches just by visiting the dentist once and simply talking to them about toothpaste and toothbrushes. The third important aspect when choosing a toothbrush is, of course, the head of the toothbrush. That is, it's the part where the bristles are located. And a lot also depends on this head. The larger the toothbrush head, of course, the greater the cleaning area. That is, with a single motion, you can actually cover or clean quite a large area. And that's a good thing. So the bigger the head, the larger the cleaning surface. But at the same time, it's very difficult to reach hard to access areas with a large head, especially if the patient has trouble opening their mouth wide. Well, let's say the mouth doesn't open as wide as we'd like, so it's hard to reach the farthest, the last teeth, the molars as they're also called. When choosing a toothbrush, speaking about the head, it's better to look for a small one, a small head so that it's as versatile as possible. Yes, you will have to spend a bit more time cleaning certain segments because the brush covers a smaller area, but at the same time, you will definitely be able to reach those far back distal teeth, which are deep inside. It's very important to clean them because one of the biggest mistakes, which we see in a large number of patients, is that while the visible teeth, the ones people can easily reach, are in good condition. And as we can see, the condition of the teeth is quite poor when the patient can't reach the very last molars. There you often find cavities, decay, and gum problems, simply because the patient says, I brush my teeth, I brush them every day, I brush them twice a day, yet they still have issues with those teeth. This is directly related to poor quality toothbrushing. The patient simply doesn't brush their teeth thoroughly enough. A small brush head allows us to reach even the most hard to access areas.
And in commercials, they often show all sorts of toothbrushes where there's a rubber piece inside the brush head, or they show that on the backside there's a rubber part for cleaning the tongue and the inside of the mouth, as I understand it. Is that actually a good thing, or can you just use a regular toothbrush?
Everything that is developed by companies involved in dental health, whether it's toothbrushes or toothpastes, certainly has a certain scientific evidence base behind it. Let's put it that way, right? And all these different inserts, additives, toothbrushes, some kind of rubber or silicone parts that supposedly allow for better, higher quality cleaning, they really do have their place. That may well be true, they really do help. Organizations are specifically working on this in order to genuinely improve the quality of brushing, make it easier, or increase its effectiveness. But a toothbrush can have different inserts. You can buy one with various types of inserts. The main goal is not to injure the gums, not to damage the enamel, and most importantly, to clean thoroughly. If the rubber insert or any other addition in your toothbrush helped you remove plaque faster and more effectively, by all means, let it have that rubber insert. And if it didn't injure your gums or wear down your enamel, then of course, let that rubber insert stay. So here, again, if we're talking about doing this ourselves without a dentist, then everything is based solely on our own sensations, just these purely human, logical feelings. You check if it cleans well, great, so that's perfectly fine. You can use toothbrushes with different inserts. It really just helps and makes your job easier. But again, I want to emphasize, do this thoughtfully and knowledgeably, and most importantly, listen to yourself, to your body, to your teeth, how well it works for them, how well they accept it. And the fourth point, which is also very important when choosing a toothbrush, is the bristles or the filament. That's exactly what we'll be using to clean our teeth. Well, here too, everything is very, very individual. But the first thing you should pay attention to, of course, is, let's say, the naturalness of the bristles themselves. Of course, they should already be synthetic or nylon. I don't know if they exist now or not, but it seems to me that maybe these are not artificial bristles, but natural ones. That's why only artificial bristles should be used, because bacteria accumulate or multiply very quickly in natural ones. As for the bristles, they come in different types, sizes, and lengths. That is, sometimes a single brush can have bristles of varying heights. The most important thing here is that it fulfills its cleaning function, so you can be completely relaxed about this. There are brushes with different bristle heights where you can actually see these wave-like patterns on a single brush. The main thing is that the bristles are artificial. The most important thing is that you can feel how these bristles are cleaning everything for you. There is also a huge difference in the number of bristles on a brush. So once again, I want to say that all of this is very individual. So your task is to make sure that none of these bristles injure your gums. And in fact, bristles very often can injure the gums. While brushing, the bristles, let's say, fluff out or spread in different directions, and they get under your gums. Very often patients start to notice and say, my gums just hurt after brushing. There's no blood yet, no signs of inflammation so far, but after brushing, the gums start to hurt. And this is exactly where the choice of bristles comes in. In other words, if the bristles are incorrect or don't hold their shape, they start to splay out in different directions, right? That's why you absolutely need to pay attention to the choice of toothbrush, the choice of bristles, or the quality of the bristles. Nowadays, all modern toothbrushes, if we look at them under a microscope, have bristles that are either polished or bent at the tips. This is specifically to ensure proper brushing, so we don't injure our teeth, so we remove plaque, and most importantly, so we don't damage the enamel. That's why, practically speaking, I think all modern toothbrushes are made this way now. In general, the quality of the bristles on a toothbrush really does affect the quality, and most importantly, the overall health of our teeth.
Let's say I go to the store. How do I choose the right toothbrush? Should all this information be written on the packaging, or how can I avoid making a mistake?
That's a very practical, everyday question. Of course, when we go to any store, we can't really take the toothbrush out and hold it properly, because most of the time they're in packaging. So I want to say right away, there's always an element of experimentation involved. So if you're trying to switch to a new toothbrush right now, and of course if you've never used this particular toothbrush before, there's always going to be that element of experimentation. You can only look at it visually in the box, turn it around, even though the packaging is transparent, turn it and take a good look. It's hard to say for sure that it will fit perfectly in your hand and that the bristles won't hurt you. Of course, it's quite difficult, but what do I pay attention to, or what would I recommend paying attention to? Well, of course, first and foremost, it's my own experience, right? So for example, I had a toothbrush like this, and I look at it and see that in general, it's similar to the handle of my own toothbrush, the one I have. That's it. First, just visually. Second, of course, we look at the firmness of the brush itself. I checked that too, figured it out. My brush is medium firmness. I also always check the brush head. I looked at it and more or less I understand that my previous brush allowed me to reach those hard to access areas. This brush head is the same. That's it suits me. And of course I look at the number of bristles. I try to choose between 4,000 and 6,000 bristles. 4 to 6 for me personally, that's enough. That's why I emphasize this point. Why is it still necessary to come and see a dentist? The dentist will actually hand you an already unwrapped toothbrush. You'll be able to hold it, and not only that, you can even use it. We have a service where you can stand right here in our dental office and brush your teeth with that toothbrush. This is so that, first of all, the doctor can see how correctly you're doing it, right? This is called a hygiene lesson. Of course, it's better to come in for a checkup, but if you can't, check the handle, count the number of bristles on the package, look at the packaging to see the stiffness, medium or whatever you need, and that will be enough. But keep in mind the experimental aspect, the fact that this toothbrush might not suit you or you might not like it. I want you to be prepared for that. That's perfectly normal. And separately, I'd like to talk about electric toothbrushes. In fact, a lot of patients write to us in the comments and ask us to talk about everything related to electric toothbrushes. Right now, there is an overwhelming variety of different modifications specifically of electric toothbrushes, and honestly, that's a whole separate topic. We will definitely make a separate video about that. But when it comes to choosing, basically, it's all the same principles. Of course, we look at how comfortable the toothbrush is. What are the advantages of a toothbrush? One is that there are different programs. That is, you really can choose a gentle program, you can choose an intensive program, or you can select gum massage. So, well, I personally believe that an electric toothbrush definitely saves time when brushing. If you use it correctly, in my personal and subjective opinion, an electric toothbrush cleans more effectively. So my electric toothbrush really does clean better. Personally, I use both a manual toothbrush and an electric one. There aren't any rules like I use the electric one in the morning and the manual one at night. No, I just use the electric toothbrush about 3 times a week, and that suits me perfectly, and I can see how well it cleans. So it's the same with the electric toothbrush here. Of course, pay attention to the range of programs the toothbrush offers, so you can choose gentle cleaning, quick cleaning, intensive cleaning, or even options with ultrasound or pulsation. Of course, first and foremost, look at the selection of programs and also pay attention to ergonomics, because an electric toothbrush should be very comfortable to hold in your hand. A lot depends on this. It shouldn't be too heavy, but at the same time, it shouldn't be too light either. This will really help you with the quality of your toothbrushing and also prevent the brush from slipping out of your hand. An electric toothbrush should be part of your home arsenal. You definitely need to have one in your bathroom. But how often you use it, whether frequently or not, and how much you make it a part of your routine, that's entirely up to you. The main goal, whether you use an electric or a manual toothbrush, is for you to brush your teeth twice a day and to do it thoroughly. That's it. So, whether it's electric or manual, it's up to you to decide. I always say, never, under any circumstances, fall for marketing tricks or gimmicks. That's not always the case. Your task is simply to brush. If you can, just spend 5 to 10 minutes brushing your teeth in the morning, for example. That's great. Some people have less time, so they use an electric toothbrush. It cleans well, you check the result, and that's it. So once again, the main thing is to brush your teeth. The choice of brush is up to you. Write in the comments if you use an electric toothbrush. Just write electric toothbrush. If you use a manual toothbrush, write manual toothbrush. How do you choose a toothpaste? Actually, the approach here is the same. It's very individual. So we choose a toothpaste. If we're talking about not consulting a dentist right now, then we choose a toothpaste based on the specific issue we want to address. Because now there are a huge number of different brands, modifications, and problems that toothpastes are designed to solve. These include gum treatment, enamel restoration, cavity prevention, and also toothpastes with very good cleaning properties. So there are various options for what a toothpaste can do or what problems it can address. Therefore, our task is to understand what exactly we want. If you have gum sensitivity, of course, you choose a toothpaste designed to reduce gum sensitivity. If your gums bleed, then you choose a toothpaste that helps you, if not cure, then at least restore or somehow stop the process currently happening with your gums. In other words, you buy a toothpaste for gums. If you have heavy plaque, then you should use a toothpaste with strong cleaning properties. If your teeth have darkened or if you feel your teeth are not white enough, you can use a whitening toothpaste. But the most important thing we need to do is, first and foremost, you should use different types of toothpaste throughout the day. What does this mean? It means you need 2 different toothpastes per day. For example, in the morning you brush your teeth with a whitening toothpaste, and before bed you brush your teeth with a toothpaste that strengthens your enamel, one that contains a high amount of fluoride and various elements that help reduce tooth sensitivity and seal the dentinal tubules. This is what it's called. Yes, when the special ingredients in the toothpaste seal your tubules, you no longer experience that sensitivity. So the first rule, use 2 different toothpastes throughout the day. That's the first thing. Second, how can this help? It's because the microorganisms living in our oral cavity multiply very quickly, even if you've just brushed your teeth. The colony of microorganisms in your mouth is restored just a few hours after brushing your teeth. Well, that's just how our bodies work. It's nature. That's why these microorganisms very quickly get used to the antibacterial agents that are present in all toothpastes. They adapt to them, become resistant, and then those agents no longer kill them. That's why you need to change your toothpaste, not just during the day, but it's also recommended to change both your toothpaste and toothbrush at least once every 6 months. Specifically, you should change your toothpaste every 6 months. Just buy a different one. It can be from the same brand, but just a different type. And in the same way, use 2 different toothpastes throughout the day.
From time to time, I see this kind of purple whitener on the internet. Is it actually okay to use these kinds of whiteners or not? How good of an option is it for whitening your teeth?
You probably just happened to come across that purple whitener. There are actually a lot of whiteners out there, ranging from toothpastes with a whitening effect to various types of trays. Now, especially on marketplaces, there are all kinds. Ready-made trays you put on, some gels you apply yourself. But when it comes to anything related to teeth whitening, I would be as cautious as possible. If we want to whiten our teeth effectively, these products actually contain hydrogen peroxide. Women use hydrogen peroxide to bleach their hair, right? It's just a different concentration. It's the same with teeth. So in order to whiten teeth, we have to remove the pigment from the enamel, the very thing that gives our teeth that darkness or grayish tint. And hydrogen peroxide pushes the pigment out of the enamel. It literally pushes it out. There's a chemical reaction that occurs, displacing the pigment from the enamel, and our teeth become whiter. So once again, I'm saying you can compare this exactly 1-to-1 with how women bleach their hair. It's exactly the same with teeth. In any case, all whitening is based on hydrogen peroxide, on this very chemical reaction. So take this very seriously. If the formula is untested, well, at worst, you just won't get the shade you want. Your teeth either won't whiten or won't whiten the way you expect. That's the least amount of harm that can happen. First of all, you can seriously burn your gums, actually cause a real chemical burn, not just in one spot, but imagine almost your entire gum, both upper and lower. We've had patients like that too, with burns on both the upper and lower jaws. So it's a real genuine burn. And most importantly, we can damage the enamel so badly that you'll end up having serious problems with it, and it will take you a very long time to restore. That's why when it comes to whitening, I would honestly be extremely cautious here. Or if someone you know has tried it and recommended it, saying, hey, I got this effect, it's great, well, you can give it a try. Or if you do decide to go through with it, try it on a small area first, see what effect it has, and then if you don't get burns or allergic reactions, well, you can proceed. What else can I say? But above all, and I'll always say this, it's best to consult a doctor. Let them take a look and give you advice. Of course, there are different types of whitening available now. I'm not saying you have to do whitening only right there in the dentist's chair, but at least go and consult with a dentist. Say, here's this product I bought, what do you think? Can I use it or not? I think the doctor, as a person, let's put it that way, will also give you practical advice. Listen, let's give it a try. Let's try it right here in the chair and see how it goes. After that, you'll be able to use it calmly at home. If you still have questions, you can write to me in Messenger. The link is in the description.